Okay, so what is Medical Wonders? So we're a student-led and nonprofit organization to educate and advise students about the astounding medical procedures, careers, and devices. So we have 4 executive teams of researchers, editors, communicators, and graphic designers. We have about 50 tutors and 10 college overseers to help us put STEM-related topics on our second account. And we have 200 members that are involved in our main board, ambassadors, chapter leaders. So we have a lot going on, and we have a little bit of our board on here before we kind of get into this major part of the panel. So I'm just going to introduce myself and have some of the board members as well that are already on. That are part of the main board. So my name is Sonia, and I am the founder of Medical Wonders. I started this in March 2020, so it's been a while, and I'm a high school senior in New Jersey.
Hey guys, my name is Mega. I'm the marketing director at Medical Wonders, and I am a high school student in Florida.
Hey guys, I'm Tian and I'm from California. I'm a junior in high school and I'm the assistant for Medical Wonders.
I'm Danielle. I'm another marketing director and I'm a junior from California.
Yeah, so just a quick reminder that all of these people that were introducing themselves have worked a lot on this panel, so I couldn't have done it without them. So it's really important and cool that they're here and we were able to do this on such a crazy amount of time. So okay, so this panel is going to be recorded on our YouTube. So we've had actually a medical week about a few months ago in the summer, and people were able to get shadowing hours because doctors came on and talked about their schedule and also did a lot of case studies. So make sure you guys follow our YouTube. You can just type in Medical Wonders and it'll pop up, and members that are on this currently and have signed up, we are taking attendance. So even if you sign up and you know someone that isn't on here, they're not going to get 1 hour to 2 hours of Medical Wonders hours. So we're going to release more information on that. But if you're not a member, you won't be getting any hours, but you'll be learning a lot from this panel. So definitely stay tuned and definitely stay for all of it, because we were able to use a lot of your questions and formulate them, and you'll also learn about different medical fields as well. Okay, so how does this work? This was released on our Google form, but today we are going to be just going over all of the medical professionals. We have a bunch of really dedicated and motivated people that are on here that are going to be sharing their experiences and everything medical related. So definitely email us, and we have our Instagram there as well, and email for any questions or concerns, and we hope you enjoy. Okay, so these are the order of segments. So introduction, schooling, specialization, I wish, and your choice. Pre-questions, whichever ones that you guys actually gave in the Google form. We'll have an open Q&A section, and then we'll have wrapping remarks.
Okay, so segment 2, everyone's going to talk about their schooling, their specialization, or specialization that they're going to do. We gave everyone your choice, so kind of whatever they want to talk about, something they're passionate about, and then I wish is just going to be advice, regrets, something they wish they did, something that they didn't do, and stuff like that. Okay, everyone's going to introduce themselves, and we're going to start with Ms. Tom.
You're muted.
So sorry. Okay, can you hear me now?
Yep.
Okay, great. I just wanted to first and foremost thank you all at Medical Wonders for inviting me to be a part of this panel. You guys are doing some really amazing things with creating awareness, so I'm really honored for the opportunity to be here. My name is Melissa Cox. I'm a nurse practitioner in Southern California. I am dual board certified as a family nurse practitioner and an emergency nurse practitioner. So I am in the fields of emergency medicine as well as medical aesthetics. So I get the best of both worlds. I get to save lives in the ER and enhance natural beauty in my med spa.
Hi everyone, my name is Gajal Kumar. I am a trauma surgeon. I'm also double boarded in general surgery. I'm from New York originally, but I'm currently practicing in Oklahoma. I'm married and I have 3 little babies. They're 4, 2, and 1. So I'm pretty busy with them as well outside of work. And I'm very grateful to be on this panel and share any information that I can or answer any questions that you may have.
Hello, can you hear me?
Yep.
Okay, perfect. Well, thank you for inviting me on this panel. It's incredible to see what all of the youth are doing now with medicine. I'm very proud of you all. Keep going at it. And yeah, thank you for inviting me. I'm a 3rd-year podiatric medical student, and my passion is truly to teach people and educate them about what podiatry is, because when I was younger and I was around the age of all of you, I had no clue that there was something like podiatry out there. And so when I finally discovered it, it was a huge deal for me because it is my passion now. So yeah, if you have any questions, of course, talk to me, and I hope you all gain a lot of knowledge today from what I'm about to share. Thank you.
Hi, thank you so much for having us. We're super excited to be on this panel, and this is a great opportunity, so thank you. I'm Alicia.
And I'm Natasha, and yes, we are twins. You're not seeing double.
So we went to Cornell University for undergrad, and we're currently 2nd-year students at Harvard Dental.
And a fun fact is that during COVID, we learned that we were the first twins to be accepted to the program, which was super exciting, and it's a very small program. They accept 34 students every year.
So we're like 6% of the class.
And in our spare time, we enjoy hiking. We love to write and advocate. We also, a fun fact, I'm not sure how many of you know who Cody Simpson is, but he's like the Australian Justin Bieber, but he requested us to make an official music video. So that was our 5th grade claim to fame. And we made the video for him and it hit 2 million views. That was super fun. And we also love volunteering in our spare time. And we're really excited to be here. So thanks for having us.
Hi there, my name is Edna Ma. I'm a board certified anesthesiologist. I live in Los Angeles right now, but I grew up in Colorado. I'm ethnically Chinese, 1st generation American born. My parents immigrated to the United States from Southern China. So I'm the first one in my family to go to college and graduate from there. I did my undergraduate at the University of Colorado in Boulder, medical school in Denver, and I matched in UCLA's anesthesiology department 10 years ago. So I'm probably the oldest one on the panel. After I graduated residency, I got recruited for the show Survivor. Yes, the Vote You're Off the Island Survivor. I was did not win the Survivor show, but subsequently I was casted for Shark Tank as well. Currently, I have 2 young kids, 8 and 6, and writing some children's books, as well as practicing in the private practice world of anesthesia. We're getting hit by COVID here and getting the overflow from the hospital, so we're quite busy.
Okay, so we're so excited to have all of our amazing panelists on. We're going to move on to the next segment. So everyone's going to talk about their schooling, their specialization, advice, what they wish they didn't do, and something of their choice. So I'm going to start with this class again.
So for my undergrad, I went to San Diego State. I graduated in 2005. I actually had a bachelor's degree initially in kinesiology. And that's shortly after when I started my career really in medicine, which was now about 16 or so years ago. So I started as an orthopedic technician. It was at a level 2 trauma center in San Diego. And initially, my intention was to actually go to a PA school, perhaps nursing, but I really fell in love with the nursing profession once I started working there as an orthopedic technician. That led me to the point to start my master's in science in nursing at Western University of Health Sciences in 2009. That's in Southern California as well, like eastern part of Los Angeles area. And then as a new grad RN, I went straight into working in the emergency department. First I was an RN, and then as a charge nurse, and then now as an NP for the last 7 years. And I'm just really grateful to have had the opportunity to collaborate with so many amazing interprofessionals over the years. I've really just learned so much about human connection and the power of keeping your passion first. I've had the opportunity to really learn and care more about my patients on the inside just as much as the outside. And overall, I really just love creating awareness, helping people to optimize their total health and wellness, to help educate and empower individuals to lead a healthy lifestyle. And basically, the launch into more of an entrepreneurship in my career was over the last 2 years. So in 2019 was when I actually had the opportunity to open my own med spa. So that's Aspire Weight Loss and Wellness. And we just get to help people feel beautiful inside and out. We have a goal to keep people healthy and keep them out of the ER. And the passion is just engaging people in the ongoing process of improving their own health and well-being, because I think now more than ever, we're really come to realize that health truly is wealth. And the bad news is time flies, but the good news is that you are the pilot. So just helping people get back in the driver's seat to their health and happiness. So something that I wish I would have known back in the beginning of this journey, I guess, was really that you are the one that has the power within you to create your most successful, your most happy, and your most healthy life. You know, the power of being intentional about what you want and going after it, for staying committed to excellence, and always working to get better and learn all that you can. The field of medicine is constantly changing. And we always want to, no matter what your profession is in the world of medicine, we always want to give nothing less than what we can to give the best possible results for our patients. So just challenging yourself to never settle and keep on pushing yourself, because really when we're challenged is the only place where growth happens. And then more recently, I've really been focused on, you know, helping to create awareness about simple ways that we can boost our immune system. So with that, that's the Beat 19 campaign. And basically it's 6 simple action steps that you can take to help boost your immune system and put yourself in the best position possible, not just for immune health, but also metabolic health, which is also so interrelated with mental health as well. So that's my most recent passion.
Thank you so much, Melissa. I love what you're doing. Okay, so now that Melissa's done, we're gonna come back to her with questions. So if you have any questions, write them down, hold them. We're gonna go on to Dr. Kumar.
Hey guys. So I guess the first part is schooling. So like I said, I am from New York originally, and I kind of knew from a young age that I wanted to do medicine. So I started pursuing these accelerated medical programs, and I ended up going into a 6-year program at Penn State in Jefferson. It was a BSMD program. They currently no longer have a 6-year option. I believe that they only have a 7-year and possibly also an 8-year. But I'm very glad I did it. It was a challenging program to get into, and there were a lot of stringent requirements during it. But once I made it through, I was very grateful to have gotten in and have been able to do the program. So I always had an idea that I wanted to do surgery, not really sure what kind. During med school, I did my rotations and kind of had a feel for different fields, and I just always gravitated back to surgery. So I applied for a surgery residency, and ended up matching back in New York, my home state, for general surgery. And during that time, those 5 years, I just fell in love with trauma. I loved how unpredictable it was, that you never knew what was coming in during the day, that you can see such a wide range of injuries, and that you also had a lot of ICU time, which I really like as well, because it was kind of more of like the cerebral part of it versus the hands-on part in surgery. So it was a really good balance for me. So I decided to apply for a trauma critical care fellowship, and I ended up going to UC Irvine for that. So for I Wish, I really have no regrets. The only thing that I probably would say is that I'd had a very little understanding of the finances of medicine and how expensive it can be, and that you should really start working on, if you're taking out loans, to start paying those off like as soon as possible, or work with like some sort of financial advisor, because those things can pile up very quickly as you make your way through residency. And then there's one other thing I do regret is, although I have traveled quite a bit, I did during residency and now as attending, I did have the opportunity to do a semester abroad during medical school that I did not take in Australia, and I do regret not doing that. So that says the same thing, but for my choice, I kind of wanted to talk about some of my passions. I also teach yoga part-time, and I'm an avid runner. I did a 25K race this morning before this panel. I love doing marathons. I've done all the world major marathons, and I think it's just very important to keep your interests and hobbies as a forefront in your life, and not to let that kind of just go into the background despite your career and your family and other things like that. So, that's it.
Yeah, we're really sorry for the typo.
That's okay.
But
okay, well, we had a little technical difficulties, but thank you so much, Dr. Kumar. Very interesting. We love. Okay, next up we have Diksha M. So she's gonna go and talk about her schooling.
Okay, I like that everyone's sharing all of the backgrounds, so I'll do the same. I had a very windy road to medicine, so I hope this inspires a lot of you. I also always knew I wanted to be a physician. So everything I did was catered to that. So after my undergrad, I spent actually, I think it was 2 or 3 years, or maybe just 2 years, but trying to figure out what I can do to bolster my application for medical school. So I was a mental health worker, and then I also took a few more classes to boost my GPA. And at that point, I decided I applied to Caribbean medical schools. I had packed my bags, I was ready to go, and then I was too nervous to do it. So I didn't end up doing that. I didn't apply to any other medical schools. And then I saw that there's an opportunity to do a special master's program. So at this point, by the way, the reason I did all of this was because I was told by an advisor that I should be a little more wary about what I'm doing and everything after they saw my stats. Don't believe advisors when they say things like that to you. It's not that you shouldn't believe advisors. Of course, listen to them, but take what they're saying with a grain of salt, because if I could go back, I probably would not have listened to them. But at the time, I didn't know any better, and I wasn't very, very confident in myself. So I thought, okay, then what I need to do is not apply to any medical schools at all, and I'm just going to keep working on my application. So at that point, I applied to a special master's program, and I basically did the first year of osteopathic medical school. And then that was when I decided, okay, I can either wait to apply to medical schools, or I can see if there's anything else in medicine that I really like. So I did a lot of research, I watched a lot of YouTube videos, and I decided on podiatry. And so at that point, podiatry, the good thing about it was that I could have applied in a month and I still would have had a shot at that point, because I like to say podiatry is the best kept secret medicine. A lot of people don't know about it. So at that point, they still had a lot of spots available. So if your application was good enough back then, you know, you would have possibly had a chance, even if you're applying late in the cycle. And so I was lucky enough to get in. I definitely had fallen in love with it after shadowing. That's another tip that I'd give. Definitely shadow. And don't have any preconceived notions about any field in healthcare, because you won't know what you like or what you don't like until you do it, or until you shadow, sorry. Yeah, and then podiatry, I might explain a little later, but I'll just say it now. It's 2 years of didactics, and we take the same classes as osteopathic and allopathic medicine, so DOMD. We do the same things. We have the same type of rotations. However, we also have lower extremity courses. We also have lower extremity rotations. And some of the schools, some of the programs around the US might not have OBGYN or psych rotations, just because it's not as related to our profession. And then we have residency for 3 years and then fellowship for 1 to 2 years. And what I wish was, if I could go back, I would have just hoped to hear about podiatry a little earlier, and also just had more confidence in myself. So please, to all of you who are high school students, college students, like, believe in yourself, and your journey is your journey. And if you want medicine, you will get it no matter what. Yeah.
All right, sounds good. Thank you so much. I actually didn't know about this program until I stumbled on your account, so that's pretty cool.
Okay, now we're gonna have the Nanji twins, Alicia and Natasha. So if you guys wanna go ahead.
Perfect. Okay, so we went to school at Cornell University and we graduated in 2019. We're from Toronto, so we're considered international students, and we're currently on F1 visas. And we majored in human biology, health, and society. It was an awesome major. It was very multidisciplinary. So we got to take a lot of cool classes, like not only the prereq, so biology and physics and all that fun stuff, but we also got to take fashion classes. We got to take ice climbing classes and random classes it was really cool. It was really well-rounded education. And then we both got a Bachelor of Science, and we're currently at Harvard Dental Medicine. So this is a 4-year program. And the thing that's really cool about Harvard specifically is that we're with the med school for the first year. So our entire first year is spent going to hospitals, doing physical exams. We take the exact same courses as the Harvard Medical School. We take the exact same exams as them. Natasha was at MGH this past year, and I was at Brigham. And it's very cool because one of the things that people don't think about when they think of dentistry is the oral systemic link. And right when you think of dentistry, people just think, ew, like you're looking into mouths all day. Why would you want to do that? And it's funny because both of us, we grew up thinking that. We're like, oh, I don't know why someone would ever choose this career. But it's super fascinating. Once we started shadowing more, we noticed that there's an actual connection between your mouth and the rest of your body. So your mouth is a gateway to your body. It is anything that enters your mouth. Inflammation, they're finding really cool studies on Alzheimer's disease, diabetes, cardiovascular disease, and correlations in the mouth. Yeah, exactly. And I guess one other reason we chose Harvard was the opportunities available. So right now, we're really involved with Harvard Innovation Labs, and we're currently working on our own startup called AppBuddy, which is allowing for increased affordable application help for pre-meds and pre-dent. So that's been a really cool opportunity for us. And in regards to why dentistry, Alicia talked a bit about the oral systemic link, but I'm just gonna quickly share my story because as Alicia mentioned, we both were actually like disgusted at people's mouths and the bacteria inside of all of them. But it was after I actually was at a nursing home, and we're at a nursing home and we were dealing with a senior citizen and we we're getting her denture fixed. And it was after the denture was fixed she was saying that how she was able to talk again, how she was able to go socialize, and how her life was basically falling apart because of an aspect in her mouth. So something outside of the clinic really got me going back into the clinic. And for me, in 6th grade, I actually ended up chipping my front teeth. And it was then that I realized that I couldn't socialize anymore. I was just a complete different person. I was very quiet in class. And I really realized the impact of dentistry on one's self-esteem. And then upon shadowing more, the oral systemic link came in, and just the connection of being able to interact with patients and make a difference. And I think one of the main things with dentistry that's super cool is that you get to fix things kind of immediately with your own hands. And I think that's awesome. I know for me, I like the instant gratification part. So when a patient comes in and they're in pain, you can do a root canal and get the patient out of their pain. And you see the difference when the patient comes into the clinic versus when they leave the clinic. And it's such a wonderful feeling to know that you've made that impact. I know for many other careers, it's like you prescribe medication, and it's a 3-month course that the patient needs to take it for. And dentistry is a lot of it's very hands-on, and there's a blend between the art and science. There's also a lot of flexibility. So if you want to start your own clinic, or if you want to work on any side hustles as a dentist, it gives you some flexibility, which is also, I think, a great aspect to it. Perfect. So in regards to advice, I think the main thing is mentorship is essential. So whether it's a friend, your parent, your professor, be sure to seek out mentors. And you'll be very surprised. Many teachers, they want to be your mentors. I know at first it can be very intimidating to go try to find someone to talk to and connect with, but they go to office hours, connect with them, because at the end of the day, it's amazing to have someone you can look up to and have a similar path or something that you can ask them your questions, because you're not alone on your journey. So find the people, there are people willing to help, and reach out to these people. And then the other point is to have a growth mindset. And it's really important that you have to look at failure as something that is actually a positive thing. I know it sounds really hard, and it might feel really disappointing when you fail, but it's really important to know that you can grow from failure. We actually realized that through failing, that's actually what helped us become better at whether it was a skill or a hobby. It was through initially failing many, many times. And what you see today, I guess, for all of the panelists is a success and us being on the other side or through our journeys. But it's so important that we've all also failed many times, and that what motivated us to get back up and continue our journeys. An example of that is when we were 16 years old, as Natasha, I don't know if you mentioned this, but we love to volunteer, and we both have thousands of hours in volunteering in high school as well as in college. And one of the things that we started in high school, we started a program for senior citizens. And when we were 16, it's like 2 16-year-olds. We started giving pamphlets out and asking for sponsorships from the community. And initially we were told no. And we were like, what are 2 16-year-olds? Why do they want my money? What program are they going to start? This is going to fail. And eventually by us talking to the community and keeping our head, raising it up and being able to talk to the community, we're able to start this program. So definitely learn from your failure and keep going. And even though in the moment it might not feel like you're doing well. And then we're not gonna read off the rest of it, but it's so important to celebrate small wins. We really hear all the time, even when we got to dental school, it's like, oh, I'm only gonna be happy when I get into university. I'm only gonna be happy when I get into med, dental, different schools, or I'm only gonna be happy once I get into specialty. And I think it's so important to realize you're living life every day. And it's so important to keep that happiness throughout, regardless of where you are in your journey. And then these are some other tips that are really important, whether it comes to studying or your mindset. So you can just feel free to read off those slides.
All right, thank you so much for that. I definitely learned a little more about dental school.
Now we have Dr. Edna Ma. She just wants to unmute herself, and you can go ahead.
Okay, I think I had mentioned a little bit about my schooling, but in terms of tips, in terms of school, unfortunately, the way the system is set up in terms of the selection process, exam scores and transcripts are important. So when you're studying, I always recommend that students think like an examiner. And I kind of applied that same approach when I applied for the show Shark Tank. I had created a product that numbs the skin, just like we numb the skin before starting an IV before surgery, but for applying that kind of same concept, preemptive analgesia, and creating a kit that numbs the skin before beauty procedures like waxing, laser, hair removal. So I was thinking like a shark. If I want to be on the other side, or asking for somebody's help, think like that person who might be proposing the questions. So what I did for the show, I watched every single episode of Shark Tank. I watched if the contestant got a deal, no deal, what questions were asked, and wrote those questions down and answered them as if they pertain to my own particular business. And when you're studying, you think about, okay, I understand the oxygen dissociation curve. Here it is. What 2,3 TPG, whatever, and you unloads oxygen. Think like an examiner. What kind of questions we'll be asking? And for me, the easiest way to do that was to look at old exams. And so I'd recommend whatever the subject is, try to look at old exams and think like an examiner. Regarding specialization, I chose anesthesiology. Going into medical school, I was pretty much, you only know what you're exposed to. I was exposed to internal medicine doctors, going to doctor's appointments, seeing primary care physicians. But once I started doing the rotations in medical school, I saw that there was all these other subspecialties besides the core, like surgery, pediatrics, that type of thing. I loved that anesthesiology was like using your knowledge of internal medicine and applying it in the operating room, but there was a lot of technical aspects of it too. We do procedures, we do intubate, we're in the mouth, just like the twins were saying. There's a lot more information about you called it the systemic health effects, and that is really fascinating indeed. So we kind of incorporate what we learned from medicine, apply in the operating room, but also do regional blocks. Other areas of other specialties that I kind of looked at included like cardiology and surgery, but I liked anesthesia because it really allowed me to be more flexible with my schedule. And going into anesthesia, I was kind of, honestly, part of the business aspect of medicine really became a priority. One of the things I learned early in primary care was some of the pediatricians that I were rotating with, they spent one whole weekday organizing, double checking the billing and submitting insurance, requesting insurance, seeing if that was on formulary. And I thought that was just so overwhelming that was intimidating to me, that I would be limited by what was on formulary or what was approved by insurance and dictating my medical decisions. And I thought, well, anesthesiology is a great specialty because no insurance carrier is going to approve surgery without anesthesia. So I know I will be paid. So kind of echoing that sentiment somebody said earlier. And I would say that as long as you're able to get into medical school or whatever tertiary medical education you want to pursue, nursing, podiatry, and now there's a new podiatry show on Netflix, My Feet Are Killing Me. So I think that that's putting a more spotlight on that. As long as you can pursue your dream, I would recommend not worrying about the financial aspect of it, because you will be in a profession where you're pretty much guaranteed to make money and pay those student loans down as long as you're working. That is like a guaranteed income for you. Medicine is one of those specialties, or like healthcare is one of those specialties you cannot outsource. It cannot be outsourced to a cheaper part of the world. Maybe some of the diagnostic stuff can with radiology, but it has to be performed and delivered at that patient's side. So don't let that be a hurdle for you if this is something that you truly want to pursue, because the money will come. For me, in terms of like the next question, I wish or regrets, I said I had no regrets in this area. The things that I did to kind of get the travel bug out of my system, if you will, I did live overseas. I studied over in England for a year in undergraduate. And I recommend, if a lot of undergraduate students are out there, to explore that option. At the University of Colorado, where I was able to do a direct exchange. So I found students that were willing to come from European countries to take my spot at CU Boulder, and I would go in their spot for a year, and it was a direct exchange. So it cost basically nothing for me to go. And there are programs like that in all universities. Then in medical school, basically I kind of buckled down. There's not a lot of options for that, except maybe some medical missions. I was able to do a medical mission in residency, and that was really, really eye-opening. You just basically just deal, you tend to be creative, you MacGyver whatever medical equipment is, to make that person have successful surgery. And I found that allowed me to be really creative and to be a problem solver. And all of us here on this panel today are here because we are problem solvers. Last thing is, after residency, I was recruited for the game of Survivor. I was in South Pacific in one outfit for 5 weeks, one pair of underwear, no toothbrush, nothing, for 5 weeks. And if you have any questions about that, I'm happy to answer that. So I do feel like I had a very broad exposure and broad opportunities to travel. And just quickly about my other things about myself in terms of my personal life. Being a woman, and this is true, not just me, but the studies have shown with the pandemic, I don't want to say burden, but the responsibilities of the home, your career falls on you as the female home provider. And that is it can be pretty stressful. And I would say in that regard, learn how to delegate and be resourceful with the people around you. Right now, my children are not bouncing off the walls because my sister and my husband are helping. And you have to enlist their help. You have to ask. It's not a sign of weakness. It's called team building. And I guess if anybody has any questions, I would say feel free to either message me in the chat or you can find me on Instagram. And I forgot to thank our organizers for this. You guys are in high school. I'm very impressed by your initiative and creating this forum, because obviously I didn't have this growing up. And I feel like listening to these other panelists say, reach out to a mentor. Now we have this platform, we have social media. Any of these individuals can be your mentors. And it just takes a direct message. And no time in history before can you just like direct message somebody that you want to be your mentor. And so the worst thing that they can say is no, and you can just go on to somebody else. Like the world is at your fingertips. So I commend everybody who's took initiative to do this, because this is not going to just increase your own exposures and increase your strength as an applicant in whatever direction you pursue, but it can be it's just like a platform, a foundation for you to do other things.
Yeah.
Thanks.
Yeah, thank you so much. Yeah, we don't just have a lot of speakers as well, but we also have like panelists. We have undergraduate students that are on our panel, on our more permanent panel, and they give a lot of advice for pre-graduate school. So taking the MCAT, taking all of the prerequisites for any of the courses that they're doing, and they're pretty diverse. So we have a few people in the pre-vet, we have people in the pre-dentistry, we have pre-med, and then we have pre-PAs as well. So definitely check that out on our Instagram, but yeah. Okay, so now we're gonna have the pre-questions. So these questions are just from the Google form that you guys had to fill out. And we picked the ones that a lot of people had questions with. But before we go into the pre-questions, I just wanna tell you guys that since this is a woman in medicine kind of panel, I know Dr. Ma kind of went off on, being a woman in medicine. So I would just urge the rest of the medical professionals to talk about their experiences as a woman in medicine, what it means, any struggles that you had in any of the years when you were obtaining these degrees. So whoever wants to start first, it's an open floor.
I mean, I can just say that being a woman in surgery, specifically trauma surgery, it's definitely a minority. There's a picture up on my Instagram of when I started in my department where it's like, I don't know, like 30 older white males and me, just straight out of fellowship when I joined. So it can be a little bit intimidating. I think you just kind of have to learn to hold your own and not be scared and just show that you're meant to be there and that you're one of the group.
I would probably echo that. I would say that right now, this generation is a lot more women. And even there was a very inflammatory article written by an anesthesiologist actually criticizing medical schools for accepting women applicants because women applicants traditionally do not work full time. And she was saying that it was irresponsible for medical schools to accept these positions, and because the medical schools take money from the state and taxpayer dollars, but those medical students do not eventually practice full time. And you can imagine how much anger she got from the community. But I would say that that is traditionally true, but I would say that right now, more than any other time in the history of medicine and in healthcare, women are predominantly the primary providers, physicians, and such. And I would say that there are making accommodations for everything in terms of like lactation rooms, where you can pump after you've had a baby and return back to work, and that is now a requirement. So now more than ever, there is support for you to pursue your career, and not that let your gender be an impediment.
Just going off what the previous panelist said, I really think it's important as a woman. Right now, there's only 30% of women in dentistry, even today. So I think it's important that all these careers do need more representation. And I know there was a study done at Stanford that actually paired up the provider based off race and ethnicity to the patient. And they noticed that there was actually decreased rates of heart disease, and a lot of chronic disease markers went down after they aligned the physician's race and ethnicity. So I think it's really important that as soon as we start increasing the number of POC providers out there, it really will help also our patients. So yeah, there definitely are barriers, and we felt them as well, even when we were in the hospitals last year doing physical exams. But I really think it's important to keep pushing, because we do need that representation to help break down these barriers and reduce these disparities that currently exist.
I just wanted to add the thought that, you know, the comment to not be scared. I think for me, it's more, especially as a woman in medicine, being embrace the fact that being scared will be part of your journey. It's not going to go away, but you just have to make the intentional effort to fail forward, as the twins were talking about, like not being afraid to fail, looking back on your failure and actually realizing that that has been something to catapult you to the next level and actually push you to be better. But it's only in the hindsight sometimes that we see that. But embracing that fear and doing it scared, you know, because you will be scared. Like, and that's not just in the beginning of your career. It's also halfway through, maybe even towards the end, and actually seeking out the opportunities where you're scared, because I really think that's the prime time when we're challenged and where the real growth happens that catapults us to the next level. And as I always say, not being afraid to be a freshman again, just because you're a woman, not being afraid to ask questions, be teachable. And in addition, I think a lot of women tend to not throw back to the ladder to the people that have helped them. So remembering the people that threw the ladder to you to help mentor you along the way, but then also throwing the ladder back, you know, not only being intentional about seeking out opportunities to find mentors, which are so important, but also seeking out opportunities to throw the ladder back to then give back what you've been given.
Yeah, that's very true. I agree with everyone in that. I may have not had a very extreme I didn't have any extreme cases, thankfully, yet. But I've definitely felt the fear. I feel the fear every time I'm in clinic or at any rotations, because like it was said before, even in podiatry, most of the physicians are males from what I've seen. Thankfully, on social media, I get to see wonderful, wonderful female leaders that I can look up to. But I definitely do have the fear often where I think, oh my gosh, that person, I wish I didn't think this way, but it's kind of automatic for me. I see a male answering a question correctly, and I immediately think, what's wrong with me? Why am I don't know. I also want to represent females everywhere. And so I'm also thinking, oh my gosh, I have to do double the work now. What have I done? Why didn't I know that question? But at the end of the day, we just need to do our best, and we're all going to grow, and everyone's going to see your hard work regardless. So yeah, just push yourself, and you will fear in any new circumstance, or even in surgery. During my surgery rotation, I felt that way. Somehow every surgeon was a male at the hospital I was rotating at. yeah, I don't remember one female surgeon. It was kind of disappointing to see that, but I'm glad to see that in our profession, in all of medicine, that there are more females, and we just have to make sure we pursue it ourselves and help the next generations.
All right, thank you guys so much for your perspectives. And I know a lot of people that are on this call right now would really appreciate you guys talking about it. So the next part, we're just going to go into the specifics. So for right now, we just have podiatry and medicine questions. We'll be going in this order. So this is once again, what we saw on the Google form. And we'll have another section after we preview all of the pre-questions to answer more questions in the chat. So I'm just going to leave it to the people that these questions pertain to. So I know, Diksha, you could start off with the first question.
Okay, let me know if I talk too much because I like to talk about this.
Okay.
So what is podiatry, right? So podiatrists are physicians, surgeons, we're all trained as surgeons who treat the foot and ankle and the related structures of the lower extremities. So a lot of podiatry is basically treating a wide variety of symptoms and conditions that patients can have. So we treat people from pediatrics to geriatrics and athletes to diabetic patients. And we see a wide variety of patients every day. And a really cool thing about podiatry, as the twins are saying about dentistry, is that we have we can witness and see an immediate relief for the patients for their pain or discomfort when they come in, usually. And we basically treat the patient from diagnosis through treatment, surgery, and recovery a lot of the times. And many podiatrists enjoy a healthy work-life balance. So we work about 40 to 60 hours in a week, and it's wonderful. Some specific cases that we go through just to help you guys gauge what it's about. We see fractures, we see ulcers, wounds is what I mean by that. Nail care, foot pain, bunions, nerve-related conditions. What I like to describe podiatry as is basically we're the general physicians of the foot and ankle is essentially what it is, because we can do anything that's related to the foot and ankle. And of course, our scope of practice is different depending on the state that we're practicing in the US. And of course, around the world, if you might see posts from people in the UK or Australia or something, but they do practice differently than we do in the States. Yeah, so we can pursue surgery, sports medicine, dermatology, pediatrics, wound care, diabetic care, forensics. There's so much that we can do with it. And normally podiatrists practice in a private practice setting, but we can work at hospitals, emergency rooms, urgent trauma care facilities, sports teams, which is another thing a lot of students pursue podiatry for, and veteran affairs hospitals as well. So any advice for students who want to pursue a career in the medical field, but unsure if they want to be a physician or be in the research? Oh, okay, that's an interesting question. If anyone else wants to answer that as well, but I can answer part of it. Like I've said before, make sure that you shadow. Shadowing is very essential. You won't know what you don't like or you do like if you don't shadow. And as far as research, does any other panelist want to answer that?
Yeah, the floor is open to anybody. You guys can add on, give remarks, answer questions as we go. So who wants to start?
Yeah, because you can figure out whether you want research or not throughout your educational career. You know, you don't have to know that immediately if that's what the student was asking.
And you can also do both. I do some clinical research as a physician, and that doesn't necessarily mean you have to choose one or the other. So you'll know as you go through your undergrad training and or education rather, and medical school or whatever higher education you do, whether you want to be more towards the research side or not. And even if you decide to become a physician, you can still continue those efforts as a researcher.
All right, so the next question is, this is just a given for anything, but how did you know you want to pursue medicine? So kind of your story on that.
Okay, I'll just go first. I haven't said anything for a little bit. So this is Edna again. And for me, just to remind you, I had my parents came over from southern China. They didn't really speak English. I was basically hauled everywhere to all their doctor appointments, traffic court violation visits, everything as their personal translator. And I just thought, going through that experience, I'm like, wouldn't it be really great to have like this language skill, cultural knowledge, and to be able to treat people without having to go through this embarrassing process of having to disclose whatever personal problems you're going through with this 8-year-old, 9-year-old translator. And that was really my first experience in wanting to try to help and being that kind of problem solver, if you will, and bridging that cultural and language gap. That was my first exposure, first shadowing from the other side, if you will. And that's why I thought internal medicine would be a great way to do that. But then obviously took the anesthesiology route, which I still do those things, but less so since the patient is unconscious. Okay, I'm passing the baton.
Mm-hmm. So it doesn't just have to be medicine people, you know, doctors. It can definitely be nurses also, because we actually haven't covered a nurse so far. So Miss Cox, you're our first one. So
Okay.
if you definitely want to talk about being an NP.
Yeah, absolutely. So the reason I really wanted to do the nurse practitioner route, I knew when I went into my master's program that I wanted to do the NP route. You know, you have several, the way it was set up at my school, at least at the time, was it was a second degree program for people who had started out with a bachelor's in something else. So just because you have a bachelor's in something else doesn't mean that your career path can't change a little bit. I actually did not want to be a nurse in the very beginning. You know, I knew I wanted to help people and I knew I wanted to heal people. I have always been drawn to that. It's just a part of what is in me as a person. But the way that led me to the nursing part was honestly being influenced in the hospital by just so many amazing nurses. Once I thought I knew what they did, but the truth is I didn't. And once I saw nurses in the trauma room, basically, you know, basically running the show in there, they were just amazing. There were some were males, some were females, just being a sponge and soaking up and learning all that you can about the different roles that people play. I just really feel grateful to have found the path for me that led to being able to be more autonomous as far as the nurse practitioner goes. So it's just it's an extra at least 2 years of school beyond the nursing part. So my journey to it took schooling longer than perhaps if you knew in the very beginning that you wanted to be a nurse practitioner. So for me, I did the bachelor's part first. But so when did I know that I wanted to be in medicine? I guess to answer the question, I think I always knew, but it was just a matter of time of twisting and turning life's events to lead me exactly where I was. There's no straight path to where you're going, and it's never too late.
All right, sounds good. So the next question is, what was everyone's experience in med school? We can keep it short because it's probably long, but yeah.
For me, and oh, sorry.
No, please go ahead.
I would just say that it was very much a work hard, play hard kind of atmosphere for me. You had 3 weeks of just intense studying. If I remember correctly, our exams were like on a 3-week schedule, and then you just kind of like had a week of just like letting off steam and having fun with your friends and going out. So it was like bunker down, study, exam, and then like a little bit of relaxation before you did it again, and that continued that cycle.
So one
Yeah.
Oh, sorry, go ahead.
No, you two should speak. I keep talking, so.
No worries. So I think one thing to add on is that it's very collaborative. I think that's one of the most amazing things part of med school, that in undergrad at Cornell, it was so competitive. The weed out classes honestly are horrible. It's such a cutthroat environment. And I feel like it's just a very toxic culture to be a pre-med. So definitely also try to change that culture, because like be collaborative, support each other. You're going to be future colleagues. And it's so important to be able to help each other, share your notes, and be able to, like, if you understand a concept, help your friend out. It goes a long way. But yeah, med school itself last year was very collaborative, and dental school is the same. And I think it's because of the pass fail curriculum that we have at our school. It's very different than undergrad when everyone wants to get that A in the curved classes and stuff. But as Alicia mentioned, everyone's going into healthcare to help people. So if you're going into help people, make sure you're starting and setting that example from undergrad, and try not to be that competitive gunner, as they call them.
Yeah, I've seen that unfortunately, in medical school itself. Too many people come in with the pre-med mentality still, and they want to, like, say if they figured out some resources, they don't share it, or they don't want to support you if you're starting a new project or something. Just try not to be that person. I think when you show other people that you're not like that, they're more willing to open up, I think, and be more collaborative. So yeah, so that's also important. And my experience, I'd say it takes some time. It definitely takes time. Every new class that you take, every new semester is like a whole new ball game. So you just have to figure out how you can adapt, and you speak to, like we've all been saying so far, all of us panelists, you need to have some sort of mentors, upperclassmen who can help you and guide you through courses, or just, he'll help you schedule things, because that's also important. You need to find time for yourself, because sometimes we forget and our mental health goes down the drain, and then we're just overstressing. Yeah.
Thank you, Deeksha. So I want to address the second to last question. It says, what is the easiest doctor to be? Can you be a trauma surgeon, neurosurgeon, general surgeon, and emergency med doctor at the same time? I think by what is the easiest doctor to be, they kind of mean like, what is a doctor that will take the less time? Because we all know being a doctor is not easy. But if anyone wants to get to that question.
I can kind of talk about that. So yeah, so like you were saying, there's no easiest doctor to be. So if you're looking for an easy career to get into, then being a physician, or pretty much most healthcare fields, I would not be looking into that. But if you're talking about what is the shortest duration or amount of time to get into, basically everyone does the same 4 years of medical school. And then at that point, you decide what residency you want to go into. And they range from 3 to 6+ years. So, and someone can correct me if I'm wrong here. Medicine, internal medicine, family medicine are 3 years, I believe. OB might be either 3 or 4. And there's several that are in that 3-4 year range. And then you have the longer residencies like surgery and anesthesia and other ones that take a lot longer time. So I wouldn't let that amount of time be your deciding factor, because an extra year or two is not going to, you're in this career for a long time, that extra time is not really going to make a difference if you're choosing what you want to do. And as for the other part of that question, I know a lot of like TV shows and things make it seem like 1 second they're doing trauma, and then all of a sudden they're flying into the operating room and doing brain surgery, and then also it doesn't work like that in real life. So a general surgeon, you can do trauma surgery, which is what I do. There's several fellowship options after general surgery, and trauma is one, cardiothoracic is another, colorectal, and there's like 10 different ones that you can go into. But emergency medicine and neurosurgery are all separate residencies. So, I mean, you could redo another residency and be both, but you can't just go from one to the other without doing that extra training.
Yeah, that's definitely good. I think that's definitely a misconception because all of us love to watch Grays and stuff like that, and they're always doing so many different things at once, which is already hard for doctors. But the last question we got a lot actually is kind of your study tips. The next slide we're gonna be focusing on dentistry, so Nanju Twin, that's all on you guys. But we just want to hear from the the doctors and even the nurse and the podiatrist, the future podiatrist. How do you guys study? Because we know med school, we know all of these schools are kind of ruthless when it comes to studying the material. The body is just so much we still don't know about. So how do you study and then manage to also keep a lot of relationships and social life?
Could I also answer the second to last question, the what is the easiest doctor to be when as far as timing wise?
Yeah.
For podiatry, just going to mention it again, our residency is also 3 years. So basically the reason for that is because it's mostly surgery, but also we start our rotations, not even just rotations, but we really start hands-on training through workshops and everything early on top of our didactic courses. So that's something else to think about, because some people who really wanted, they really want ortho, but they don't exactly want to take that much time because they have families of their own or whatever their case is. It's another reason that they choose podiatry, because instead of doing ortho and then pursuing foot and ankle, because that's a possibility, they go to podiatry so they can just go straight into foot and ankle. And then I'll just answer that question too. How do you study and manage everything? My biggest tip is before you even start medical school, or even when you're in undergrad, try to use a planner. And I think the best advice I've ever been given is put down all your self-care activities first in your schedule and then add in study time, because you need to take care of yourself before you can take care of anyone else, or you can even be effective with your studying. So if that means exercising, if that means meditating, if that means prayer, or whatever it takes, if that means spending time with family, put that in first and then plug in your study time, and make sure you're chipping away a little bit at a time with your lectures. Don't try to save everything for last minute. I know undergrad is like that. I know it can be like that in high school, but it's helpful you just have to think about your future self. Your future self will thank you for putting in the little bit of 10 minutes extra a day of studying the material you learned that day.
All right, we can move on. So our next segment is dentistry. We had a lot of people indicate that they were interested in a pre-dental path. So we have all these questions. Some of them we went over, so definitely skip it because we are a little off time a little bit, but yeah, these are very specific questions. So the floor is all yours.
Sounds good. Firstly, I'm happy to see that there are so many people interested in the pre-dental path. That's very exciting. And also, if we don't get through all these questions, definitely feel free to message us later. We'll put our IG handle in the chat later. So I think it's important to mention that the pre-med and pre-dental path are essentially the same all throughout college. So you're going to be taking the same courses. There are no separate prereqs for dentistry. Yes. And then, so what are things I can do in high school if I'm interested in dentistry? So one of the main things that many of the panelists have mentioned is to shadow. So go see what's out there. This leads to the next question of how you can find shadowing opportunities, but be sure to send lots of emails and try to connect with dentists in your area. Ask your dentist if you can shadow. And I know with COVID right now, it's extremely hard to find these shadowing opportunities. So Dr. Ma mentioned this, but be sure to message people. It's at your fingertips. Go on Instagram, go to panels like this, like Medical Wonders. This is amazing that you're putting this on, but try to connect with as many people you can in the current field. And you can also, I know this sounds really lame and tacky, but you can also look at different YouTube procedures, as lame as that sounds. I know it's not in-person shadowing, but I think it's actually great for dentistry because there's like 10 people's, like there's so many hands in someone's mouth that you actually can't see what's really happening as when you're standing like on the other side of the room. So I think it's important to really look on YouTube, look for any procedure you want. And there are amazing channels out there to help guide you through that. And another thing is that it doesn't need to just be shadowing. It can also be working at startups. So Alicia and I love entrepreneurship, and we actually worked at an oral healthcare startup. And that was a really interesting experience in New York City. And if anyone's interested in hearing more about that, we can talk about that later, or again, message us. Another question is, what led you to pick your career in dentistry? We kind of touched up upon that, but I think the number one reason for me is that there's so many disparities right now that exist, and it's important for us to break down those barriers. Right now, if I were to ask you all, what's the number one childhood disease? You might answer something, a medical thing, but actually it's dental caries, which are also known as cavities. So I think it's really important to know that there, with that burden, there's also there's oral health literacy issues, and this really faces those who are minorities. So right now, both of us are working on a project called the Oral Systemic Alliance. And what it does, it's the first club at Harvard Med and Harvard Dental School, but we're collaborating to actually disseminate flyers out there about the oral systemic link. And we're partnering up with different hospitals and clinics to really get this information out there, and we translate it for different communities. And then in regards to GPA, so we definitely prefer an undergrad bachelor's degree. I know there are some programs, for example, in Ireland that you could apply straight from high school, but if you are doing an undergrad bachelor's degree, which is most all American dental schools and Canadian dental schools do require an undergrad bachelor's degree. And as Natasha mentioned, there's same requirements as medical school. Any advice on preparing for the DAT? The DAT is the dental test. So a quick plug actually is that we're doing a giveaway, and it's $1,000 in value for Crack the DAT. And they're essentially a program that allows you to prepare and do your best on the DAT. So quick plug that you can enter the giveaway if you're interested. Yeah. Sorry. We always do this. Yeah. Surprised we just started doing this now. I think one of the biggest things is that do all the questions that you also get right and wrong when you're studying. So be sure to have a notebook and practice every day. And one of the main things to even redo the questions you get right is because if you got it right, maybe there's a shorter way to get to the answer, or there's so many different ways that you could get there. So be sure to redo those questions as well. Yes, I was just going to say that. And I think preparing every day is very important. And again, focusing on the ones you also got right. I also think it's important that it's very important to actually take your notebook and highlight each thing that you need. And it's important that active learning is more, doing those problems rather than just reading textbooks and stuff. Are both of you interested in working in the same or different specialties? So there are, just like medicine, there's many different specialties you can do in dentistry. For example, perio, which is gum, like the gum doctor, ortho, braces, and then endos, like for root canal. So it's when a cavity gets really bad and you need to basically like replace the entire tooth. And we're not sure yet. We're second year, so we still have some time to decide. I think general, honestly, is also very cool. General allows you to do a bit of everything. So general's definitely an option. Exactly. So we're not entirely sure yet. And then what's it like being twins in the same profession? That's a really awesome question. For us, I think it's really cool that we both ended up in the same school, let alone like the same profession, because we never thought we would be. We're best friends, as you can probably tell, but I think it's really awesome to be going through this path together. It's actually funny because a lot of people ask us if we want to start our own clinic together, and then like one of us works like the first 3 days and then the other one works like the last few days of the week. And I think these are such funny suggestions. So we're open to any other options. And another thing that goes off of is for studying, be sure to find an accountability partner. So we're lucky to have a built-in best friend and a study partner, but find someone in your class, even with virtual classes, try to get on a Zoom call with someone, study with them, quiz them, test them. It really makes studying more fun, and it allows you to actually, it's great to be able to rewrite your notes and stuff, but we have found that when you say things out loud, and teach the other person the concept, you really know if you know it or not. So try to do that concept before exams. And advice for impressing dental schools. So I think one of the biggest things here is quality over quantity. So don't spread yourself so thin and join a million different clubs on campus, and don't do that because it's just very stressful. And I think it's more important to make an impact in a fewer number of clubs, even one club, rather than joining a bunch of clubs and not making an impact. And then in regards to what extracurriculars should we do, I really think, as Alicia mentioned, find something you're passionate about. And I know you've probably heard this a million times and it sounds really cliche, but one thing I did that really helped me is you can write a list of 20 activities or hobbies or anything you're interested in. It could be advocacy for mental health awareness. It could be anything. So write a list of 20 and then prioritize them. So you're going to prioritize them in the way that you want, which activities you want to do at the top of your list, and then start ranking them. And then only focus on the top 3 every semester. And this is really important because you can't spread yourself out so thin, because then there's no space for for your own mental health and your own self-care, as every other panelist was saying. So it's really important to focus on the top 3 every semester and try to focus on the top 3 throughout your 4 years. But then you can also start adding in the other ones and start re-ranking them if you find yourself not interested in the first one that you might have listed. So I think it's really important to write out that list. And if we didn't get to anyone's questions, or if people want to message us, feel free to. We're more than happy to answer them.
Thank you so much, guys. I feel it's so cool that you guys know so much, but right now we are going to open the floor to any questions. You can unmute yourself and ask them. You can ask them to the whole panel if there's one specific person, but I do know Shania Seth did say, hey everyone, I was wondering why the Nanji twins chose to pursue their studies in the US rather than a Canadian/Ontario university. Thank you.
That's a great question. So we get that question a lot, and it's really funny because we got into, I'm not sure for the Canadians out there, but McMaster Health Science Program was the other program that we were really debating. We were really debating, and once we got accepted to Mac Health Sci, we compared it to the programs in the US that we were accepted to. And I really think at the end of the day, it's whatever you choose when it comes to the curriculum. So we looked at both curriculums, and we really noticed that with some programs, some Canadian programs, it was very tunnel vision, which is great if you absolutely know you want to become a doctor or a dentist. But when it came to the US programs, it was a lot more of a liberal arts program. So we got to take a lot of writing classes and a lot of different classes outside of just the physics or the calculus and stuff like that.
All right, I got another question, and someone asked, so it was specifically for Dr. Kumar, but can you explain more about the BSMD process? Because it's very underrated, especially as a senior. I only knew about it when I was just applying to college, so just before time, but could you definitely talk about that?
Yeah, for sure. So yeah, it's one of those things that if you don't know about it, you're just going to miss out on that opportunity. So you apply for it at the same time that you're applying for undergrad, but what you're doing is you're applying to both the undergrad and the medical school at the same time. So you really have to know that this is what you want to do, because you're kind of committing yourself to medical school at the age of 17 or 18. So you do your application, and they usually have a lot of like requirements, like a minimum GPA and SAT or ACT score. And once you meet those and they ask you for an interview, you actually interview. From my experience, I had to interview at both the undergrad and at the actual medical school. So you feel like this child walking into like med school, and you're interviewing there on this campus with like these people that are much older than you. But it was a very cool experience, and I'm very glad that I did it. There's if you just Google BSMD programs, you can find the list of ones that are still available. And they've kind of moved away from the 6-year. There even used to be 5-year options, but most of them are 7 or 8 year now. I think there's like 2 6 years left. But even then, like, even though you're not cutting your years down by a lot, you're still have that guaranteed acceptance, which kind of can take away a lot of the stress of having to redo a whole nother application process after your undergrad to apply to med schools, to make sure that your resume looks great, that you have all these things, letters and all those things that you have to do when you're applying. And that whole stress is gone because you already know that you're accepted to the medical school.
Yep, that's definitely true. So I'm gonna take two more questions because that's all the time we have. I don't want to keep all of these medical professionals from their jobs, but the next one is about research. So a lot of questions about doing research in high school and especially during this COVID pandemic, especially as a high school student. So anyone is free to answer that.
Okay, well, before that question, I just want to pop in and say, everyone that wants all of our panelists' information, their Instagrams, I am going to put them all in the chat right now, but you can also go into the Medical Wonders Instagram and they are all tagged in there on their posts. On every post, there's everyone tagged. And another thing is, I'm sure everyone would be fine with you DMing them with all your questions for them specifically, or about podiatry or dentistry or surgery. So if you have anything extremely specific, make sure you DM them, let them know, and I'm sure they'll be happy to answer. So yeah, you guys can answer your research questions.
I think it's really important for research. You don't need to just do research on like wet lab stuff. So I think that was a misconception I had going into during my undergrad experience, as well as currently in dental school. There's a lot of research you can do in the social sciences realm if anyone's interested in that. Admission officers aren't looking for people who cured cancer or solved this crazy disease. And I think it's really important that you can do research in the social sciences. And I loved, as Alicia mentioned, senior citizens and gerontology research. So I studied that throughout college. And in regards to finding research opportunities, first one is definitely email professors. And you can send emails to professors that you haven't met on campus, but be sure to customize them and take time to get to know these professors, look up what research they're doing, read some of their papers, and show you're actually interested in their papers. And another way to find research is that you can actually go to your office of this is high school. But once you're in college, a good tip that I found was going to your office of biology or office of education. And some schools have listservs. So Cornell had a listserv. And once you sign that, these offices typically give out the listservs and tell you how to join. And once you join this listserv, they give out weekly research lab openings. And also just one quick thing to add on is don't be afraid to follow up. All your professors are human, and it's so important to foster an actual human connection rather than, hey, can I do your research in your lab? Because they're human at the end of the day. And don't be afraid. Your email is going to get lost. They might not respond to your first one, but if you send follow-up emails, they're going to know you're persistent and you're persevering, and they will slowly reach it back out to you. And sorry, last thing, promise. We do have a research template. So if anyone wants to have it, it's important to personalize each one, but we do have a standard template that we use that we're more than happy to share with you.
Yep, that sounds good. So that's all the questions we have, and this kind of wraps up our panel. If you can go to the next slide, Nida. Okay, so we just wanted to say thank you for all the panelists. Thank you guys for all coming. Thank you guys for spreading the word. We really appreciate it, and we definitely appreciate all the medical professionals kind of coming on and talking about their experiences. So thank you guys so much. And if you guys want to contact them, they're putting their Instagrams in the bio. Definitely reach out to them for any opportunities, any questions. We're always here, and you can always reach out to all of us as well. On the board, most of us, we have a lot of college students, a lot of pre-med students as well. And I have also had experience with high school shadowing and stuff, so definitely feel free to reach out also. And definitely follow us on our Instagram. If you can go to the next slide, at medical.wonders, and then our TikTok is at medical.wonders. But if everyone can just thank all of the panelists for coming on, we really appreciate it. And this will be posted on YouTube, so don't forget about that. And definitely follow us because we will have a lot of different other opportunities. But thank you, and if the panelists can just say for like 1 minute after, but everyone else is free to leave.
Yeah, thank you guys so much. And I do want to point out, we have so many new things coming in the coming weeks. We have stickers, merch, we have a podcast that's getting released. So definitely look out for those. And this panel that we're doing right now is going to be on YouTube. So yeah, check us out.
Okay. Okay, so I'm just gonna take a quick picture of us so we can just put it on Instagram story. But I'm just gonna take a screenshot really quick. But thank you guys so much for coming on. I learned a lot, and I think we all learned too a lot about everything. So I'm just gonna stop recording.